morning. Today's topic is skin circulation, or we say cutaneous circulation. Okay, circulation of the blood through the skin is known as cutaneous circulation. We learn the topic under three headings. Number one, functional anatomy, regulation of cutaneous circulation, applied physiology. Under functional anatomy, we'll see the blood supply, we'll see the normal value, we'll see the innervation. Under the regulation of cutaneous circulation, it is regulated by neural, thermal and metabolic regulations. Applied aspects has two components: white reaction and triple response. We'll see in detail. The cutaneous circulation, as I said, circulation of the blood through the skin is known as cutaneous circulation, which plays an important role in the regulation of the temperature. And we know the skin is an important structure of the body as it covers the entire body, and the health of the skin is the beauty of the body. That is why it is given much priority, that is cutaneous circulation. The first major component is functional anatomy, under which we see the blood supply of the skin to two regions. One is called apical region, which includes structures like fingers, palm, feet, nose, earlobes, lips, etc. This is entirely different from non-apical regions other than the above mentioned structures known as non-apical regions. We say torso of the body. In the apical areas, we have arteriolar arcade, which is a network that exists at the boundary of the dermis and the subcutaneous tissue which underlines the tissues of the body. From this network, arterioles will ascend from the deep of the dermis to the superficial layer of the dermis, where they form a secondary network of the capillaries. And the capillary loops will originate from the superficial dermal network, and they perfuse the dermal papilla and the epidermis also. You can see these blood vessels very clearly in this picture. The dermal arterioles also provides vessels that supply the hair follicles and also subcutaneous glands and sweat glands of the skin or of the body. That was about your apical area circulation. Now we will focus on non-apical region, which is a bit complicated, modified. It's not complicated, modified vascular pattern is seen. The direct vascular connection between arterioles and venules, known as arteriovenous anastomosis or the glomerulus. Here you can see that. Arteriovenous anastomosis, or these are called glomerulus. They occur mainly in the superficial dermal tissue of the skin. And these anastomoses are absent, or they are very scanty or few in number in the non-apical regions. They are more in the apical regions. The normal value is very important. It is varies from 1 to 150 ml per 100 gram of the skin tissue per minute. This value is to be noted. Innervation. It is the skin blood vessels are supplied by only the sympathetic fibers, no parasympathetic innervation is observed. The activation of the sympathetic fibers, it results in vasoconstriction, and vasodilatation also occurs by decreasing the sympathetic activity, but there is what I would like to stress here is no involvement of the parasympathetic innervation. Now the second major component is regulation. It is regulated by three components: neural, thermal, metabolic. Neural already mentioned, neural already explained by the sympathetic vasoconstrictor fibers. No vasodilator system is present or supplying the skin blood vessels. What are thermal? Thermal mainly regulated by the body temperature. Increased body temperature causes vasodilatation and decreased body temperature causes vasoconstriction. Now the metabolic. It's not so important. However, some of the metabolites like local production of the metabolites like bradykinin in the sweat that causes cutaneous vasodilatation. Now the third component, very important component of the cutaneous circulation is applied physiology, under which vascular response to injury and a temporary occlusion are the major components. Under the vascular response to injury, two types of responses are observed to the injury. Number one is white reaction in response to light stroke, and a triple response to firm stroke. Light stroke and firm stroke. Now the first component, the white reaction, was introduced by the T. Lewis. When a pointed object is stroked over the skin, the pale strike line will appear. What is the cause for it? It is due to contraction of the precapillary sphincters, and also the blood will be draining out of the capillaries and from the small venules and veins is the cause. It appears almost in 15 seconds. Here is your three components of the triple response. Number one, red reaction. Number two, wheel. Number three, flare. You can see in all the three pictures the three components of the triple response: red reaction, wheel and flare. The first one, before I say about each component, I would like to tell once again about the triple response described by Thomas Lewis in 1924. He is the scientist. Triple response is the characteristic of the three-part response that develops when a line is made by the pointed object on the skin. It is produced due to the release of the chemical like histamine from the mast cells of the body. And now, out of the three components of the triple response, number one is called red reaction or localized red spot. In this, the skin becomes red in about 10 seconds. Redness occurs due to capillary dilatation which is shown in the green color, that increases capillary blood flow. The capillary dilatation occurs due to direct response of capillaries to the pressure. This is about the red reaction. The second component is flare or bright red flush. This is what red or irregular spreading out of redness from the site of injury to the surrounding area is called the flare. It is about 1 centimeter from the injury beyond the original red spot and develops very slowly. This is also accompanied with itching and pain. It is mainly due to arteriolar dilatation. Point to be noted: arteriolar dilatation mainly occurs by the activation of the axonal reflex. What is this axonal reflex? From the site of the injury, from the figure, the impulse is conducted in the efferent fibers. From there, the sensory neurons give branches to the blood vessel. The impulse, in addition to its conduction to the spinal cord, orthodromically, it is related antidromically to the blood vessels. The axon reflex is an example of antidromic conduction of the impulse. The endings of the sensory fibers on the blood vessels, they release substance P and CGRP that produce arteriolar dilatation. So now, does the redness out from the injury to the surrounding skin in the form of the flare occurs. The final one is the wheal, which occurs in 1 or 2 minutes. It is nothing but a swelling or local edema is called the wheal. And the wheal occurs due to increased permeability of the capillaries and post-capillary venules. Due to increased capillary permeability, already I mentioned, and also the histamine released from the local mast cells that causes vasodilatation and increased capillary permeability that results in extravasation of fluid. So this is about the wheal or edema. And this is the definition of the axonal reflex, which was the pathway and all were explained. The last component of the applied physiology is vascular response to temporary occlusion. In this, we can see reactive hyperemia occurs in response to temporary vascular occlusion. What exactly the reactive hyperemia? It is defined as increased blood flow to an area when blood supply to the area is re-established following a brief period of occlusion. You can see some of the changes, like the blood flow to the skin increases when the circulation is re-established after a short brief period of occlusion. It occurs in visceral organs due to vasodilatation produced by hypoxia during occlusion. This is seen particularly in visceral organs. When circulation is re-established, blood flow increases through dilated vessels and skin becomes very red. A better example in our day-to-day life, the redness of the forearm of a person immediately following his BP measurement by the sphygmomanometer is the better example. How it could be. During blood pressure recording, BP cuff is tied around the arm of the person and raise the pressure in the cuff and occlude the brachial artery at the forearm and other arteries. When the pressure in the cuff slowly released, the limb becomes red due to reactive hyperemia. The entire area of the forearm becomes red due to reactive hyperemia. So this is what about the vascular response to temporary occlusion. It is a small topic. With this, I could conclude my topic. Hope you understand what exactly the cutaneous circulation. In the cutaneous circulation, mainly few things are very important. What is cutaneous circulation and the blood supply to the apical and non-apical regions. The normal values are very important with the innervation and regulation done by neural, thermal and metabolic regulation. Applied vascular response to injury and vascular response to occlusion. Under vascular response to injury, you have two things: white reaction and triple response. Triple response has three components: red reaction, wheal and flare. And finally, the vascular response to temporary occlusion will have reactive hyperemia. So after releasing the pressure from relieving the pressure from the BP cuff, so how the forearm becoming red is called reactive hyperemia due to vascular response to temporary occlusion. With this, I conclude my topic. Hope you understand the topic. Thank you for patient listening of my lecture. Thank you very much. Thanks a lot.